Assalamu alaikum everyone. Now I'm going to speak about granulomatosis with polyangiitis. So what is granulomatosis with polyangiitis? It is actually an uncommon disorder that causes inflammation of the blood vessels in the nose, sinuses, the throat, lungs, and kidneys. So this is like the lungs, the kidneys, the throat, the sinuses, and the nose. So it has another name which is called Wegener's granulomatosis. And granulomatosis with polyangiitis or Wegener's granulomatosis in another name, it is actually one of the group of blood vessel disorders that are called vasculitis. And it slows blood flow to some organs of the body, and the affected tissues can develop areas of inflammation called granulomas, which can affect how these organs work. Okay, so this disease develops suddenly or over several months and later can worsen rapidly. So firstly, it affects the sinuses, as we mentioned, the throat, the lungs, and the kidneys, and without treatment, later it can lead to kidney or lung failure. So the symptoms and signs that can occur, it's actually first pus-like drainage with cross from the nose, stiffness, sinus infections, and nose bleedings. Also, the patient can suffer from coughing, sometimes with the bloody phlegm, dyspnea or shortness of breath and wheezing. Also, the patient can suffer from fever, fatigue, joint pain, numbness in the limbs, fingers and toes. And also we can see weight loss in the patients. We can see blood in the urine or hematuria, skin sores, bruising or rashes. Also we can see eye redness, burning or pain, and vision problems. Also later it can develop to ear inflammation and hearing problems. So here, as you can see, the exhibition of this disease, granulomatosis with polyangiitis, we can start from the oral cavity. We can see gingivitis or ulcerations throughout the oral mucosa. In the lungs, we can see cavities, bleedings, and lung infiltrates, so leads to dyspnea. And also we can see on the skin, we can see nodules on the elbows, purpura. We can also see granulomas and patchy necrosis in the blood vessels, especially blood vessels are the small size and the medium size blood vessels. Also in the eye, we can see pseudotumors or conjunctivitis. And then we can see in the nose, you can see nose stiffness of the nose, you can see nose bleeding, saddle nose, which is like we will see it later, which is degradation of the cartilage of the nose. Also we can see heart problems such as pericarditis. We can see also kidney problems such as glomerulonephritis. We see it later in the urine test. We can see hematuria and proteinuria. And also we can see positive ANCA, which stands for anti-neutrophil cytoplasmic antibody. Okay, bro, very good. So now we speak about the etiology, which is the etiology behind granulomatosis with polyangiitis is not known. It's idiopathic, so it means that it's not contagious. People cannot affect each other, and also there is no evidence that it is inherited. So there is no evidence behind like gene or something that lead to this one. And also the condition can lead to inflamed blood vessels, as we mentioned before, and here we can see the narrowing of the blood vessels, which leads to ischemia of the organs and damage. And also we can see formation of granulomas that leads to destruction of the normal tissue and narrow the blood vessels and reduce the amount of blood and oxygen that reaches body tissues and organs, which is like forming ischemia and pain. So granulomatosis with polyangiitis can occur at any age, and it most often affects people between the age of 40 and 65 years old. Okay, the complications. Besides affecting the nose, sinuses, throat, lungs, and kidneys, granulomatosis with polyangiitis can affect the skin, eyes, ears, heart, and other organs. So these complications might include hearing loss, skin scarring, kidney damage, a loss of height in the bridge of the nose settling, which is caused by weakened cartilage. And also we can see blood clot formation in one or more deep veins, usually in the leg. So deep vein thrombosis, and later it can lead to pulmonary embolism. Okay, very good. So now we move on to the classification criteria for granulomatosis with polyangiitis, and this is according to the American College of Rheumatology and European Alliance of Associations for Rheumatology. So here, this classification starts with two. We can see the clinical criteria that then in the clinical criteria during the assessment, physical assessment, we can see that the nasal involvement, which we can see blood discharge, ulcers, crusting, congestion, blockage, or septal defect, perforation. This is plus 3 points. And here we can see cartilaginous involvement, inflammation of the ear or nose cartilage. We can see hoarse voice or stridor, and also we can see endobronchial involvement or saddle nose deformity. And this is form 2 plus 2 points. And also the last part of the clinical criteria, we can see conductive or sensory neural hearing loss. So it's a plus 1 point. In the laboratory or imaging and biopsy criteria, we can see the positive test for cytoplasmic anti-neutrophil cytoplasmic antibodies or c-ANCA, or anti-proteinase 3, anti-PR3 antibodies, so it's plus 5 points. And pulmonary nodules, mass or cavitation on chest imaging, it's plus 2 points. We can see also granuloma, extravascular granulomas, inflammation or giant cells on biopsy, plus 2. Also, we can see inflammation, consolidation or effusion of the nasal paranasal sinuses or mastoiditis on imaging, plus 1. And also we can see palsy immunoglomerulonephritis on biopsy, plus 1 point. And here we can see positive test for perinuclear anti-neutrophil cytoplasmic antibodies, p-ANCA, or anti-myeloperoxidase anti-MPO antibodies. It's minus 1 point. And here blood eosinophil count for more equal to 1 times in 10 power of 9 per liter, minus 4. And here is written that the summative score for 10 times if present. So a score of more or equal to 5 is needed for classification of granulomatosis with polyangiitis. So 5 only of them we can see, so it can lead to we can make sure or prove that this is the patient suffering from granulomatosis with polyangiitis if we have only 5 points minimum. Okay, so the diagnosis is actually mentioned in the clinical criteria, but we're going to mention it like specifically. So here it starts actually when the patient comes to the hospital. So we have to do some physical examinations in addition to a clinical images latest or a laboratory test. So the physical examinations, first we're going to look for the signs and symptoms. As we saw, like granulomas, we can see vascular, like bleedings of the nose, and hoarseness, we can see dyspnea, and so on. The patient can suffer from a lot. Also we can take the medical history, maybe it can help. Also we can do CBC test or complete blood count test. We can look for signs of inflammation such as elevation of the CRP or C-reactive protein, and also elevation of ESR or erythrocyte sedimentation rate. Also, as we can see in the clinical, as we saw before in the clinical criteria, we can also see confirmed by the appearance. We can see appearance of ANCA or anti-neutrophil cytoplasmic antibody in the blood, and also we can see active that we can improve that there is actually an active granulomatosis with polyangiitis. Also, we can see typical anemia for this disease. Also, we can see signs that kidneys are not properly filtering waste products from the blood, so it leads to elevation of urea or creatinine and the azotemia. Also, we can see urine tests which can indicate kidney damage, so we can see hematuria or a presence of blood in the urine, and also we can see proteinuria or presence of proteins in the blood. We can also do imaging tests that we can see chest x-ray, we can see the nodules of the lungs. Also we can see CT scan, the normal of the blood vessels, the vasculitis, and also we can use the MRI, magnetic resonance imaging, that can show granulomas of the blood vessels and damage of the affected organs. And also we can do biopsy as a confirmation test when we can see, as you see here in the picture, with the help of ultrasound, we can see the severity and the damage of the organs. Good. Now we come to the last part, which is the treatment, where we have a rule that is written that if as early diagnosis and the appropriate treatment provided for the patient, as fast a recovery can happen, and even the recovery can occur within a few months only. And the medications that can be used are first corticosteroids such as prednisone, that suppresses the immune system and improves the patient's condition by reducing the inflammation of the blood vessels. And also we can see the side effects that prednisone can lead to. It is actually weight gain and the risk of infection and osteoporosis. So weight gain, prednisone is because due to fluid retention and also increased appetite can lead. So that's why the patient gains weight by eating more, and also because we have reduced immunity, so we have super infections or high risk for infections. And also the why we have osteoporosis, because corticosteroids, they are increasing they reduce the intake of calcium in the body and increase destruction of the bones. Um, and also we have other drugs that suppresses the immune system, which includes cyclophosphamide, that can use is actually immune suppressants, so including cyclophosphamide, azathioprine, mycophenolate, and methotrexate. So rituximab, it is another option for treating granulomatosis with polyangiitis. It's given by injection and it's often combined with corticosteroids. So the side effects that immunosuppressant can cause, it's high risk of infection, nausea, diarrhea, and hair loss. And the last treatment, which is the most effective, it is plasmapheresis or plasma exchange, which is removing the liquid portion of the blood plasma that contains disease-producing substances. And the patient receives a fresh plasma or a protein made by the liver, albumin, which allows the body to produce a new plasma. For patients with very serious granulomatosis polyangiitis, plasmapheresis can really help the kidneys to recover. So as you can see here as like we see that the blood comes from here through addition of anticoagulants, and then we can see we remove the a portion of the blood plasma that causes this disease, and then we replace it by another plasma healthy one, and then we give it back to the patient there, to the body again. That's it. Thank you so much